Good afternoon, everybody. I'm Lel Stiani from BBC News. WHO warns of Ebola health scare risks. A prominent World Health Organization official has warned that more Ebola cases can be expected among medical staff, even in developed countries with modern healthcare systems. Professor Peter Piot said that he was not surprised the Spanish nurse had contracted the disease. The nurse has become the first person known to have contracted the deadly virus outside West Africa. She treated two Spanish missionaries who died of Ebola in Madrid. The nurse, identified in media reports as Teresa Romero, looked after their pair after they were repatriated from West Africa. She remains in quarantine in the Spanish capital with her husband, and 50 other people in Spain are being monitored. Some 3,400 people have died in the current outbreak. Most of the deaths have been in Guinea, Sierra Leone, and Liberia. Dangerous moment. The BBC's Imogen Fox in Geneva says that from the start of the Ebola epidemic, the World Health Organization (WHO) has emphasized the improvised healthcare system of the countries hardest hit, Liberia, Guinea, and Sierra Leone. A man wearing a mask enters the gates of a housing estate where it is believed the nursing assistant who tested positive for Ebola and her husband live in Madrid. Protesters in Madrid on Tuesday demanded the resignation of Spanish Health Minister Ana Mato for what they say are failures leading to the first case of Ebola contracted in Europe. Teresa Romero Ramos is in quarantine in Madrid along with 50 other people in Spain who are being monitored. Its experts have insisted that modern hospitals with rigorous disease control measures would prevent infection, but our correspondent says that the case of the Madrid nurse proves that it's far more difficult than many thought. Professor Piot, world specialist in Ebola, now brought in by the WHO as a scientific advisor, warned that even the simplest movement, like rubbing your eyes, is a risk. The smallest mistake can be fatal, he said. For example, a very dangerous moment is when you come out of the isolation, you need to take off your protective gear. You are full of sweat and so on, and you take off your glasses and do like this, and that can be the end. Professor Piot that he was not surprised by the case of the nurse in Madrid and expects more cases in Europe and the US, although he doesn't expect to see the illness spread as rapidly as it has in Africa. Dire consequences. Meanwhile, the US military is stepping up its efforts to respond to the Ebola outbreak in Liberia, Sierra Leone, and Guinea. Relatives of Thomas Duncan, the first person to be diagnosed with Ebola in the US, held a vigil outside the Dallas hospital where he is being treated after catching the virus in his native Liberia. Ebola has rampaged through Guinea, Sierra Leone, and Liberia since March, killing more than half of those it infects. The virus has hit healthcare workers hard, sickening or killing more than 370 in the hardest hit countries of Liberia, Guinea, and Sierra Leone. Liberia's ambassador to the US, Jeremiah Soulant, told the BBC more treatment centers and ambulances were desperately needed. Currently, we need about 27 Ebola treatment centers, he said, but I think we have got less than 10. We need some logistical support ambulance to take people from the rural communities, to the treatment centers. All of these things we need. Ambassador Solon said that the virus was hitting a country struggling to recover from 14 years of civil war and where there were about 700,000 people for every medical doctor. The International Monetary Fund has warned of dire consequences for the economies in the region if the virus continues to spread. Madrid protests. The European Commission has asked Spain to explain how Ms. Romero, a 40-year-old actual nurse, could have become infected. A hospital investigation is underway. She was one of about 30 staff at the Carlos III Hospital in Madrid who had been treating friars Manuel Garcia Fijo and Miguel Peñaros, officials say. Mr. Garcia Fijo, 69, died at the hospital and on 25 September after catching Ebola in Sierra Leone. Mrs. Peñaros, 75, died August after contracting the virus in Liberia. Mr. Romero had twice gone into the room where Mrs. Garcia Fijo had been treated, to be directly involved in his care and to disinfect the room after his death. Madrid Healthcare Director Antonia Alemany said the nurse went into the room wearing the individual protection gear and there is no knowledge of an accidental exposure to it. This is the information I can give for you guys. See you next time. Bye bye.